Welcome, everyone, and thank you for being here today. My name is Reina James, and I'm excited to present my scholarly project entitled Implementing the STRATIFY Screening Tool to Enhance Fall Prevention in the Memory Care Unit. This presentation will cover the essential aspects of my research, including background, methods, results, and implications of practice. The specific aim of this project was to evaluate the effectiveness of the STRATIFY screening tool in reducing fall rates among elderly residents in a memory care unit. Additionally, the project aimed to enhance nursing staff engagement and adherence to fall prevention protocols through comprehensive training and continuous education. By achieving these objectives, the study aimed to create a safer environment for residents and enhance overall health outcomes. A brief review of literature reveals that while several fall prevention strategies have been evaluated, outcomes can differ significantly based on implementation. The STRATIFY tool is recognized for its effectiveness in assessing fall risks, emphasizing the need for proper staff engagement and training to enhance implementation success. I was able to identify 15 articles on fall prevention in memory care units, with 10 being primary research studies published between 2019 and 2024. These studies focused on the STRATIFY risk assessment tool, effective prevention strategies, and challenges faced by older adults with cognitive impairments. Key themes from the research provide insight into special needs of residents in memory care settings and highlight critical areas for intervention. The health promotion model developed by Nola Pender guided this project, emphasizing the importance of addressing fall risks proactively. This framework focused on enhancing health and safety of residents through early identification of vulnerabilities. The framework influenced the project by focusing on enhancing residents' health and safety through proactive risk assessments, promoting an atmosphere of fall safety awareness among staff members, and increased knowledge with education by creating a cohesive team effort to keeping residents safe. A quantitative approach was selected for this study, enabling us to measure fall incidents before and after the implementation of the STRATIFY tool. This design facilitated clear comparisons and analysis of outcomes. The research involved collecting data of fall incidents before and after the implementation of the STRATIFY tool. A total of 50 elderly residents were assessed for fall risks using this tool, which enabled the nursing staff to identify individuals at high risk for falls. The data collection involved recording fall incidents over a specified period, allowing a clear comparison of outcomes before and after the tool's integration into clinical practice. To ensure successful implementation, the nursing staff underwent comprehensive training that focused on the application of the STRATIFY tool during patient assessments. Training sessions included interactive components and practical demonstrations, reinforcing the importance of proper usage to promote resident safety. Additionally, ongoing support was provided to staff through regular check-ins and feedback mechanisms, which aim to foster engagement and adherence to fall prevention protocols. Data analysis was conducted to evaluate the impact of the STRATIFY tool on fall rates, with statistical methods used to assess the significance of the findings. For our sample size, we focused on a sample of 50 elderly residents residing in a small memory care unit. This population provided valuable insights into the effectiveness of the STRATIFY tool with descriptive statistics that included age, gender, distribution, changes in medications, physical conditions, mental health statuses, infections, and previous fall histories. The data analysis involved using a z-test for two proportions to compare fall rates before and after the STRATIFY tool implementation. This statistical method was chosen as it is effectively able to measure differences between two categorical variables. The implementation of the STRATIFY screening tool led to a significant reduction in falls incidence among elderly residents in the memory care unit. Before the intervention, the fall rate was 15 falls per 100 residents, which decreased to 8 falls per 100 residents after the tool's integration. While this indicates a positive trend in resident safety, statistical analysis revealed a p-value of 0.0824, suggesting the reduction did not achieve statistical significance. Additionally, the data collection process demonstrated improved staff adherence to fall risk assessments, as evidenced by the increased frequency of assessments conducted following training. Although the findings are promising, further research with a larger sample size and extended observation period is needed to determine the STRATIFY's tool long-term effectiveness in fall prevention. So even though I consider the small reduction rate successful, the project would benefit from a larger pool of residents and more time to conduct this study. The small population size includes limitations in the project. The sample size of the 50 residents may limit the generability of the results. Additionally, potential biases in documentation practices could influence the reliability of the findings. And also, limitations included staff consistency with engagement and participating with education requirements. Okay, so in discussing these results, it is important to highlight the relation of the previous findings regarding fall prevention interventions. The positive trend observed suggests that with further research and emphasis on training, the STRATIFY tool could play a crucial role in enhancing resident safety. The implementation of the STRATIFY tool emphasizes the importance of evidence-based practices in nursing. Despite some initial resistance from staff, comprehensive training and engagement facilitated the successful integration of the new routines into the daily lives of the residents. Practice recommendations include ongoing education and enhancing feedback mechanisms to support adherence to fall prevention protocols. The study highlights the importance of continuing research in effective fall prevention strategies in the long-term care setting. So what are the implications for nursing practice? Well, the findings from this project underscore the necessity of incorporating evidence-based tools like the STRATIFY screening tool into everyday nursing practice. It also emphasizes the continuous need for staff education and engagement. This is essential to maintain effectiveness and to improve patient safety. What are the implications for future research? Future research should explore the long-term effectiveness of the STRATIFY tool across various clinical environments with larger sample sizes. Investigating factors that affect staff adherence and engagement will be the key to refining fall prevention strategies. So we just need to continue to research with larger population and continue to educate and bring safety awareness. What does this mean for healthcare policy? Well, policy recommendations advocate for integration of fall prevention strategies to enhance overall safety and well-being, and support for best practices to promote funding for training and resources to support the effective implementation of best practices. In other words, it's essential that healthcare policy advocate for the integration of validated fall prevention strategies within long-term care settings. Policy should support ongoing staff training and resource allocation to ensure that patient safety remains a top priority. Let's see if we can help people to stop falling, to prevent injuries, to keep people safe. In the long run, that's the best thing overall. Well, what about a plan for sustainability? Sustainability strategies would include regular training and audits and monitoring by assessing adherence protocols over time to ensure consistency and continuity of care. In other words, to ensure the sustainability of the STRATIFY tools implementation, it is crucial to integrate ongoing training into the facility's operational practices. And they need to have regular audits of fall incidents that this will help keep and maintain staff adherence, and also highlights areas that have needs for improvement. What could be a possible plan for dissemination? Well, dissemination of the findings could possibly show an impact on both clinical practice and community awareness regarding fall prevention strategies. The results and insights gained could be shared through various avenues, including presentations at relevant healthcare conferences and publications in peer-reviewed nursing journals. See, these platforms would provide invaluable opportunities to engage with healthcare professionals, share best practices, and have an opportunity to foster collaborative discussions about effective interventions in fall prevention. Additionally, presenting at conferences allows us to reach a diverse audience that includes nurses, healthcare administrators, and or policymakers, all of whom will play a crucial role in shaping care practices in long-term care settings. These discussions not only highlight the evidence supporting the STRATIFY screening tool, but also invite feedback and suggestions for further enhancements based on real-world experiences. Also, publications in nursing and healthcare journals would ensure that the findings are accessible to a broader audience, facilitating knowledge transfer and encouraging other facilities to adopt similar evidence-based practices. By disseminating the findings widely, we could aim to contribute to ongoing dialogues about fall prevention and promote the adoption of innovative solutions and enhance the overall patient safety within the healthcare community for elderly patients. Ultimately, the goal of sharing these results is to inspire a collective effort towards improving care for elderly patients, particularly those residing in memory care units. Through active engagement in knowledge sharing and collaboration, we can collectively work to mitigate fall risks, optimize nurses' nursing practices, and enhance the quality of life for vulnerable populations within our healthcare system. Based on the findings of this project, several key recommendations can be made to enhance fall prevention strategies in the memory care units. First, ongoing staff training and education are very essential. Regular training sessions should be implemented to ensure that nursing staff remain knowledgeable about STRATIFY screening tools and the best practice for preventing falls. These sessions should focus on practical applications of the tool, recognizing all fall risks, and effectively responding to high risk solutions. High risk situations. Secondly, enhancing engagement and establishing feedback mechanisms for staff is critical. By creating channels for the staff to provide feedback on the implementation of the STRATIFY tool, we can foster collaboration and continuous improvement. Regular check-ins with the staff would also help identify challenges and facilitate timely adjustments to training or procedures. Additionally, standardized protocols for risk assessment should be developed. Having comprehensive and uniform protocols for using the STRATIFY tool will ensure consistency in how assessments are conducted across all shifts, helping to mitigate the variable impact of staffing changes on fall prevention efforts. Moreover, it is essential to implement a system for monitoring and evaluation. Regular tracking of fall incidents and the use of the STRATIFY tool will enable ongoing assessments of its effectiveness. The data should be collected and analyzed periodically to identify trends and make informed adjustments to each resident's care plan. Ultimately, integrating technology can significantly enhance fall prevention, and utilizing digital monitoring systems or wearable devices that track movement patterns can provide staff with real-time data, improving the identification of fall risks. In conclusion, this project highlighted the potential of STRATIFY screening tool in improving the patient safety and reducing fall incidents among elderly residents in memory care units. While the findings demonstrated a positive trend in fall rates, there is further research that is needed to validate the tool's effectiveness. But by implementing these recommendations, healthcare facilities can strengthen their fall prevention strategies, ensuring that the safety of their residents, and also enhance the overall quality of care in memory care units. This project has highlighted the importance of evidence-based practices in nursing, and it has underscored the need for a collaborative approach to addressing the issues of falls in long-term care facilities. Thank you so much for joining me today for this presentation on my DNP project. I have listed at the end of this presentation a list of references that I use to help me with this project. Thank you. Have a great day.